if you want to review it.
Lovely. Okay, well, welcome everyone to our June morning tea talk. So today we're going to be talking to you about standardised assessment in residential aged care and how PACOP can help with that and what our aims are. This is Janelle and I'm Laura, and we're going to dive straight in.
First of all, I just always like to acknowledge, make an acknowledgement of country. We wish to acknowledge the Aboriginal and Torres Strait Islander people as the traditional custodians of the land we're meeting on today, and we want to pay our respects to elders past, present, emerging and future. Today we're going to just give you a little bit of background as to why evidence-based and standardised assessment is important. We're going to talk. PACOP has two collections that use standardised assessments. Today's focus is on the profile, but we'll briefly mention the other one called the outcomes. And we're going to go through the profile collection, clinical assessment tools that are standardised. And we'll have some questions at the end if you have some. So first of all, what we've done is based on the Royal Commission. Laura and I have been through, 107 pages of recommendations from the Royal Commission into quality and safety in aged care. And basically the key principles of those findings is that older people should be cared for based on their assessed needs. And that care, it also highlights what quality aged care is. It's diligent, skillful, safe and insightful, caring and compassionate, empowering and timely. And that really encapsulates our assessment tools, our standardised assessment tools. They are diligent, they involve the resident and involve specialising their care and standardising and streamlining their care, and they are timely, meaning they're used on a standardised process collection as well.
Anyway, because they,
we also, high quality care is also based around actually finding out what the resident really needs and what their preferences are. So our assessments are resident focused and resident centred, and really they are comprehensive in that they really ask the resident and find out important clinical information for really developing comprehensive care plans.
Holistic care plans.
And holistic, exactly, that cover a range of things. But and importantly, the profile collection has and matches the recommendations in that it has a unique tool for recognising deterioration, and also it's got unique decision-making tools for picking up where residents may need palliative care.
So we'll give you a bit of background about how PACOP came about. So most of you may be familiar with PACOP, so that's the Palliative Care Outcomes Collaboration. They're a sister outcome centre to us, and they've been in operation since about 2005. So they've got a well-evidenced history of standardised assessments for palliative care. And so the idea came about that we could take that program and implement it into aged care to improve palliative care for residential aged care facilities. So they did that back in 2019, and then this became known as the Wicking model. So over the last 2 years, we've been trialling this program. We've been making adaptations based on the feedback from these homes and really making sure that we adapted the program to be something that was suitable in aged care facilities, because as we know, aged care is a very complex environment. And so what we've created now is these two outcomes through the profile collection and the outcomes collection, and that really has been meeting the aged care needs for palliative care. So we're going to go through the profile collection with you today. Now, PACOP, so we are a national program. We are available for aged care homes that are standalone centres out in rural communities and large organisations with metropolitan homes. We want to provide equitable access and resource to these facilities to really ensure that all residents, no matter which aged care facility you walk into, are going to receive high quality palliative care. So to do that, we're doing standardised assessment, standardised education. We're promoting those shared languages and really upskilling the staff. And these skills are transferable. We hear a lot at the moment about the workforce turnover, and we really want to build something that's sustainable for aged care facilities. And so the big picture is PACOP's been here for 5, 10, 15, 20 years. By the time we've been here 5, 10 years, we want an aged care workforce that is familiar with the program, and it minimises the disruption for staff turnover, and it's more sustainable for your practice. So it's ongoing support. We use a communities of practice model, and it really is that evaluation of care. So it's guiding your care plans, it's evidencing that those care plans are meeting needs, and it helps with the development of national benchmarking and national quality improvement. And we aim to show that through research, through this data, we will be able to demonstrate how PACOP is improving palliative care and quality of life for residents.
This is the bit that really excites me. I love big picture thinking, and I keep thinking, I mean, my parents are elderly now, one's 94 and one's 84, and I'm thinking about this coming up and big picture thinking. Imagine, it doesn't matter which of the 3,000 aged care homes Australia has, if your loved one is going into one, you can know they'll be having assessed routinely with evidence-based assessment. It's something that really excites me about PACOP. So here's our two collections. We have the Profile Collection, as Laura said, we're focusing on today. The Profile Collection is to standardise evidence-based routine assessment of every resident every 3 months. It also has a unique tool to help identify if a resident needs palliative care. So it really helps that decision making every time they're assessed. And it's got another unique tool for when you're worried about a resident in between those 3 month time periods. And also it guides that comprehensive resident care planning that the Royal Commission was talking about. And then the Outcomes Collection is the doing, what we like to call the doing of palliative care. So when a resident has been identified in the Profile Collection as needing palliative care, it again introduces a series of standardised comprehensive assessments and also a protocol for addressing the needs that you assess, which again guides that ongoing repeated comprehensive care planning for residents who are palliative. So let's dive into the profile. So this, what you're looking at here, is a paper version of the Profile 3-monthly clinical assessment tool. And you'll note the first part up here starts with a face-to-face assessment. And what I love about this tool is that it involves the resident. So first of all, it starts with what's called the PACOP SAS or Symptom Assessment Scale. And it's a unique tool that actually gets the resident's perspective on a range of symptoms that are really bothering or distressing to them over the previous 24 hours. So it gives you a nice little snapshot of what's going through their mind and what's worrying them. And that's a unique thing in aged care. Stemming off from that is another assessment tool called the Problem Severity Score. And that's a clinician rated tool where the clinician thinks about over the past 24 hours over a range of 4 different domains. But the unique thing about this tool, yes, pain is important and is assessed, as are other symptoms and psychosocial symptoms. But the unique part about this is that it really considers what is bothering the family about the resident's care. So it includes the family and people close to the resident and what is worrying them about the care the resident is receiving. So that's what's unique about that tool.
And it's really great to validate their experiences and involve them in the process.
Absolutely.
And that will help guide your care planning as well.
Also included is the pain check, and we know that pain is a significant problem in aged care. Many older people, in fact most older people, have some sort of pain, and we know in aged care that dementia is and being able to communicate pain is often difficult as well, and some aged care homes are using pain checks, so that's included there as well. And finally, on this side is the Australia Modified Kanowski Performance Status. Wow, that's a mouthful, but we like to call it, we abbreviate to the AKPS, thank goodness. But it is a really unique snapshot of where the resident is at as far as how their performance and how active they are and how much they're able to self-care. And it's actually, and we were chatting before about how it's a really good tool for noticing decline in residents by working out this score. So that's a unique component there. Over to you, Laura, for the other side.
So what the other one is, so often these two go hand in hand together, if you like. We've got the AKPS, which is looking at performance. So that's what is a resident actually doing. And then we look at their function. So how much assistance do they need with their ADLs? How much resourcing do we need to look after them? And so this is a great tool for agencies and aged care to understand where are they using their resources with their resident population to really plan for service provision for meeting those needs and to really identify a deterioration in a resident where they're needing more assistance. And so this is a great tool. And so what it is, it's the resource utilisation group for activities of daily living. We call it the RUG-ADL. And it gives a scale, as you can see, about how much assistance they're needing. Do they need staff? Do they need equipment? Are they fully dependent on your staff? So this is a really great way to give a really quick score and a snapshot for your resident population as to how much physical resources and time from care staff are they needing.
And these 4 ADLs are often the last 4, they're hierarchical, meaning they're the last 4 to go as residents approach their end of life as well. So it's nice to focus on them as well.
And this ties in with the Rockwood Clinical Frailty Scale. So the idea of frailty and assessing frailty in aged care is it's becoming more of a hot topic. And the reason is it's a great prognostic indicator because it actually identifies and validates the vulnerability of your resident. How likely are they to recover from an illness? How at risk are they? And so frailty is really important in residential aged care facilities because it does increase risk of dying, it increases risk of illness. And so this tool and the RUG-ADL and the AKPS are also in the new ANAC model, which I'm sure everyone's interested in hearing more about.
And what's unique about the Rockwood as well is that it also not only assesses physical frailty that makes residents vulnerable, but it also deals with cognitive frailty. And it's a unique way of assessing that as well. So it's really comprehensive in that regard.
And so then we've got some questions that are really important for our holistic view and our resident-centred care. And we're looking at communication and psychosocial needs. So identifying residents who are at risk of isolation, who perhaps are starting to have some impairment with communication, and really highlighting for staff where they might need some more support.
Rightio, over the other side of the profile, 3-monthly clinical assessment. There's no point doing an assessment if you don't have a plan for what you're going to do about what you've found. So this section really helps the clinician begin to start planning, and it's also contains a series of really nice prompts. So starting up over this side is the reason for care. So often the reason a resident is admitted can be different for the reason that created the most focus for the care during the past week. So this asks the clinician to think about what was the reason that created the focus for care in this past week. The other really important section here, and this is so important to have a knowledge of where advanced care plans are, or not for resuscitation, or whatever your aged care home calls them, and we all know there's a number of names nationally, but this is a really important prompt to know, does the resident have one? Where is it? What does it say? So it's really nice opportunity to have that recorded, to review these plans, to know where they are, because there's nothing worse than when a situation deteriorates and you're looking for these things in times of stress. It's good to have this planning up front.
And alternative decision makers too with the care plan and the family. Really important to have those discussions early on, and that really helps minimise the burden of stress and care responsibility as well when these situations occur. Having these anticipatory plans are really invaluable to your staff.
Yeah, and it makes the care for the resident and their family much more smooth, and especially if everyone's aware of what these plans are. The last section on this side includes information about hospital use, and in particular I like the unplanned hospitalisations and emergency department hospitalisation. It can help homes sort of drill down and really look at maybe our care plans need adjusting if there's a lot of unplanned hospitalisations. And finally on this side is
over 100 minutes.
ANAC. The ANAC classification here is mentioned, and that is really just, that's a new funding model coming in October this year for aged care homes nationally. And 3 of our tools in the profile collection actually are used in the ANAC classification as well. But as I mentioned before, there's no point doing an assessment if you're not going to have a solid plan of action of what you're going to do about it. So we realised that trying to standardise this across 3,000 aged care homes in Australia, we can't cover everything for everyone, otherwise this would be also 107 pages long. So we've tried to capture things that can really help clinicians make decisions about residents based on evidence, but also have some really good prompts that can help them plan for their care. So the first part of this is identifying the need for palliative care. So throughout the trial, what aged care homes said to us was that we really would love a tool that helps us make clear decisions on when a resident might need palliative care. So this side just includes a series of check boxes, yes and no, and they're based on how the resident was admitted, maybe also clinical decision making, and also it's based on some of the assessments, and you'll see in the bottom half that involves the AKPS, the Rockwood Clinical Frailty Score, and the Symptom Assessment Scale and the PSS. So it's a series of questions, and if the answer is yes to any, that's when it identifies them as that they would benefit from palliative care and move into the outcomes collection. Each of the profile collection tools will have this clinical decision tool, and that really helps, and it's empowering for clinicians to make that decision and make referrals for palliative care.
And this process too, this is really good for supporting staff to develop their clinical judgment. Often staff will recognise that there's a deterioration in a resident. The resident needs something, but they haven't quite got the background of the standardised assessments and the skills to put that into words and explain why they feel the resident needs some additional support in a care plan review. And this is really great for developing that clinical judgment in junior staff, in staff who are new to your organisation and might not be familiar with policies. This is really going to help them to feel like they have a voice and be confident in advocating for the residents.
Well, over to the action. After you've done that sort of little decision-making tool, then there's a series of prompts in the action plan. Do you want to take us through that, Laura?
So the action plan, I like to think of it a bit as there's kind of three different things that come out of the action plan. Is the resident stable? Do they need any care plan changes? And so this is someone who's ticking along nicely. All of their scores are the same. There's no changes. The care plan's meeting their needs. The resident and family are happy as Larry. So we're going to continue on. We're going to check them in 3 months. The other resident is someone who might have a few minor changes. We might need to review the care plan, consult with the family perhaps. And so these are internal actions. So it's not urgent, but it's an indication that, yes, we do need to look at and reevaluate and make sure we're meeting their needs. So that's something that is there to guide. And again, this is going to be dependent and work with your internal aged care home organisational policies as well. And then the last kind of category is someone who's had a marked deterioration or has some needs that need a timely response. And so this is where we're going to look at external referrals. Maybe they've got pain and they need to see the GP. Maybe their Rockwood or their rug ADL has changed, but they haven't had a formal physio review. So these kind of things are these prompts for clinical practice to reassess and think, how urgent is the need? Can we manage it, or do we need to involve these specialist allied health and multidisciplinary team members?
But what do we do when we're in between the 3 monthly profile clinical assessment times and we're worried about, I'll use my mum's name, Joy, and she's just not well, she's not right, I'm concerned, or her family's concerned? What do we do? Well, then that's one of the things the aged care homes really ask for. And so based on the evidence, we have delivered. So we have the deteriorating resident tool. So this is we made it green because it's your go-to tool at any time you're concerned about a resident in between those 3 monthly time periods. I'm not going to go through all the sections of this because this tool includes, as you can see, the SAS, it includes the problem severity score, the AKPS, and the Rockwood Clinical Frailty Scale. And again, as I mentioned, so those tools we've already discussed, but it will give you a unique snapshot of what's happening with this resident at this time. But importantly, what the aged care home staff wanted was, again, this decision tool for identifying the need for palliative care. And again, it's just a series of, so it's based on your clinical judgment. Do you think this resident would benefit from palliative care? Is the family or the resident requesting palliative care? Do you think they have a prognosis of less than 3 months? And so you might notice that the surprise question used to be 12 months, but pretty much, you know, that would screen in just about everyone in aged care, maybe. So that question has been brought back to 3 months. Do you think they would have a prognosis of less?
And part of that is evidence and research based as well, Janelle. So when they did some studies, they found that I think it was 19 to 20% of aged care residents passed away within the first 3 months that they were admitted to an aged care facility. Yeah. So this kind of ties in with that population as well. We want to really quickly be able to pick someone up and screen. Do you think they're at risk of dying? Would you be surprised?
And that's also in the ANAC assessment that's coming in October as well. And then, of course, it involves some results based on the clinical assessments you've just done using this tool. So if it's yes to any of those, then they have been screened as needing and they would benefit from palliative care, and therefore that's the doing section we mentioned before, and that's the PACOP outcomes collection.
And we'll be talking about that next month.
Exactly. Stay tuned, because July's morning tea talk is going to focus on the outcomes collection. But what do we hope? So we know, actually we don't hope, we actually know. It's based on the research that PACOP has done over, as you can see there, more than 10 years. They have shown that standardising assessment in palliative care has absolutely, and you can see in this graph, led to improved outcomes. We know, and because our model is based on our sister program, PACOP, that we will improve outcomes for residents in aged care by standardising their assessments and the process for assessing them. So, as mentioned, stay tuned, log in and join us next time for July's morning tea talk, where we will go through the PACOP outcomes collection. Oh, I've made a spelling error there. And basically, why are we doing that? Well, PACOP Profile has identified palliative care needs. So what now? And that's when you transition into the PACOP outcome. We haven't left you empty-handed. We have an evidence-based standardised protocol for assessing and addressing palliative care needs once they're identified, and that's the outcomes collection. So I'd just like to say thank you so much for having us. We are fully funded by the Australian Government Department of Health. PACOP is free to aged care homes who want to participate, as is the ongoing support. I'm going to stop sharing now and just open it. I know we're right on time, but if there are any questions, we'd love to hear from you. Otherwise, our email's there and you can send us a question or ask to have a look at the tools that we've just shown you today. Are there any questions out there from anyone?
Oh, I'll start. Can you hear me?
Yes, we can. Hi, Rose.
My ongoing issue is, how do you drag the managers kicking and screaming into something new? You know, I mean, it's great. I think it's wonderful. And yeah, I love the big picture thing. Yeah. But, you know, on the ground, they're just saying, oh, God, another,
can I jump in on this
set of documents.
You can.
How do we convince them? Because this is, you know, this is my
and
my job.
Sometimes this is the bit of the difference in residential aged care homes, is that it's a combination of not-for-profits and businesses and clinicians. And while, yes, we all want to achieve really good resident outcomes, they still need to be able to function as a business. And sometimes the way to speak with them about things like PACOP is talking about, it's a different kind of carrot. You know, they want to hear about how it works with the ANAC. They want to hear about how it's going to work with the National Aged Care Quality and Safety Standards, how it's going to help with their quality improvement program. So all aged care homes participate in a National Quality Indicator program. PACOP's going to provide really clear documentation, a 6-monthly data report. We're going to make it so simple for them to add to their body of evidence to say that we are working with consumers, we're consulting with stakeholders, and it really does tie in with all of these existing policies. So they all have to do respect the dignity, ageing in place, greater choices, all of these, I guess, the buzzwords and the policies that are operating in the background in aged care. We've done a lot of work and we've got a lot of resources and even one-pages. So Rosie, if you want us to flick you a piece of paper on how we can work with the ANAC and how we work with the aged care quality standards, we are more than happy to provide these resources to you. And sometimes that's just enough to pique their interest and say, okay, well, yes, you can trial it. And then they start to see the results, and that's what then gets the buy-in. And they also, we've got a range of buy-in documents for engaging different stakeholders. We've developed an entire implementation document for people who want to embed this into their home. They're supported through the process. It's based on implementation science and research. So, but we've simplified it so it's an easy, doable thing. And basically also our tools are just standardizing business as usual in aged care. They're standardizing that routine resident of the day or 3-monthly care planning process. So it's actually, in the end, whilst it's a little bit of initial work,
it will eventually streamline that process and make it so logical and
Mm.
easy to do.
And we're free.
Yeah,
Access to a full education program, full resources to support their staff, and it's free. It's government funded.
support from lovely improvement facilitators like Laura. And Nat's online too, I can see. She's another improvement facilitator. So every aged care home enters a community of practice where they are 100% supported throughout the process of, implementing, embedding and sustaining. And it's free. Yes, it's free. That's a good carrot for them. Are
Thank
there
you.
any other questions? So we know you're all busy, so we're going to finish up, but I would like to apologise for our technical difficulties. We're new at this, we're clinicians actually, and we're having a go.
We keep saying that.
We're just
Something's wrong, knock on the door. But if it's IT, we
Yeah.
need a little bit of practice.
So I appreciate you bearing with us, and we'll get better, but we are passionate about this program. I hope that came across, and we wanted to work. I know it will make a difference to residents and also staff delivering that care. So thank you again for your time, and look out for the recording in your inbox and sign up for the July one to learn all about the outcomes collection and the doing of palliative care.
Yeah.
Thanks all so much.
Thank you. Bye.
Bye.